So what you might be wondering at the end of the day is, what is the treatment? How does a psychiatrist, how does a psychologist, how would somebody go about dealing with tics or Tourette's disorder? So it actually includes both behavioral interventions and psychopharmacology, of course. Now, a core component of behavioral intervention includes what we call habit reversal training. So in habit reversal training, what you would do with the patient is you would create a competing response that is incompatible with the tic. So let's break that down with an example to make this a little bit more clear. So habit reversal training, we want to create a competing response that's going to be exactly the opposite of whatever the tic is. So in this example, let's say that the tic is shoulder shrugging. How might we go about performing a different activity that will be the opposite of shoulder shrugging? We reverse the habit. So what you would do is you would create a competing movement that would essentially be pulling the shoulders down when that urge or tension is felt. So when the person is experiencing the urge or tension the only way they feel like they're going to get relief is to, shrug their shoulders, then they're essentially going to pull them down instead of shrug them. They're going to do the opposite of whatever the tic is. That's how you would train this, and you would teach this over time. And of course, it's not going to be easy at first. It's going to be very difficult for the patient to do that, but eventually they'll get to a point where this becomes a normal pattern of behavior, and they will have performed a habit reversal. Now, there is a very specific form of therapy for Tourette's disorder and tic disorder, and that is comprehensive behavioral intervention for tics, so CBIT, not CBT, I for insomnia, CBIT, so comprehensive behavioral intervention for tics. And it's very, very effective, well-studied behavioral treatment. It's very hard to find somebody who actually knows how to do it, and that could be the bottleneck for a lot of patients, is finding someone who actually has the training and experience in working with this type of therapy. But essentially, it does what I talked about at the beginning there with habit reversal training. It's going to teach you habit reversal training, and it's going to teach function-based intervention with psychoeducation, as well as parent training and relaxation training. Because remember, I said things like stress and lack of sleep are going to make the tics worse, and things like relaxation are going to make the tics better. So relaxation training, parent training, because it's mostly young kids who are going to be dealing with this, and of course the core component being that habit reversal training. Now, if I'm doing psychopharmacology to treat tic disorder, it's a little bit different. And the way I described it when I was answering some of these questions was, I think of it as a 3-stage method, right? Now, we have 2 classes of medications that I think fall into basically the best options for treating tics or Tourette's disorder, and that is the alpha agonists or the dopamine blocking medications. So alpha agonists or dopamine blocking medications. Now, the way to think about this is the alpha agonists are going to be less effective, but they're going to have less side effects. Whereas the dopamine blocking medications are going to be more effective at treating the tics. And again, they're going to target the tic itself, but they're going to have more side effects and more risk associated with their use. So I like to say, if somebody has a mild tic, and it's not really that big of a problem for them, but they'd really like to stop and they'd really like to be better, you might want to start with something like the alpha agonists, and that would be things like guanfacine or clonidine. So clonidine or guanfacine are good choices, and if that younger kid also has ADHD, these medications are often used in ADHD in children as well. So mild tics with ADHD, alpha agonists, clonidine, guanfacine. If you're dealing with more severe tics, that's when you're going to step it up to the dopamine blocking medications. And there's really only a few medications that are FDA approved. There's actually not very many. One of them is aripiprazole, which I talked about in previous videos. The other 2 are haloperidol, which is a first-generation dopamine blocking medication, and pimozide, which is also a first-generation dopamine blocking medication. So there's some older medications, and then aripiprazole being the partial D2 agonist that you can check the video out on if you're interested. So those are your FDA approved medications. I personally will use aripiprazole or risperidone usually as my second line option. And again, for patients who have more severe tics, who this is really a big problem for them in their life, we might go to those medications after other medications have failed or behavioral interventions have failed. So another question that you might have here is, if ADHD is very common with Tourette's disorder, then wouldn't stimulants exacerbate those tics? Now, there's mixed data on that. Actually, it's kind of a toss-up, and it really depends on the patient. Some patients do have worsening tics when they take ADHD medication, specifically talking about stimulant medication, and then others can take stimulant medication without worsening their tics. So it's really kind of a mixed bag and a mixed situation there, and it will be a case-by-case basis that will determine whether or not you're going to use stimulant medication for somebody with ADHD and Tourette's disorder. I'm going to hold the video there. I think we covered a lot of important information about the treatment of tic disorder. I think we covered a lot of information about Tourette's disorder here. So if you guys have questions or comments, drop them below. And if you enjoy the content, please like and subscribe to the channel. It helps us to keep making videos for you.